Steve Beekman here with Kevin Grieme, and what we're going to be doing today is we're going to be talking about public health. Just because there is a lot that public health does out here too, and I think it'd be just great information to share about what public health really does for the community. Kevin Grieme here, he is the director of Siouxland District Health Department. Kevin, how are you doing today?
Very good, Steve. Thanks for this opportunity to visit with you about public health, a very important topic to me.
Well, awesome. Thank you so much for taking the time to visit with us here today then. Just to give you a little bit, if you'd like to explain a little bit of your background, how long you've been with District Health, and just share a little bit of information about yourself.
My original position was in 2003, so I've been here 16 years, and a lot of what I did at that point in time was emergency response planning, and I worked across the 16-county territory. This gave me just a great perspective upon what the public health system in the northwest corner of the state actually looked like. At that point in time then, it was 8 years ago, I was selected to serve in the director capacity, and so it's that background, that knowledge, and that experience across the territory that kind of gives me a different perspective on what we as a local institution within Woodbury County should be providing in public health services to our county residents.
Yeah, that's great. You bring a lot of experience, a lot of information about what public health is, and just a lot of great information to Woodbury County as well too. Then, we were just going to talk a little bit about the background of what public health is, and just share a little bit of information about that then too, because there is some things that public health does that some people are really not aware of then too.
Right. When I really look at public health, I think one of the things to help people understand is we always throw around this term prevention. I was listening with a group last night, and we asked about what's your first word, one-word description of public health, and I think out of the 12 that were there, 6 said prevention was what it would be. What we're really looking at from the public health perspective is what I call primary prevention. Clear down to that very end of the spectrum, what we want to do is we want to prevent some of the health conditions that our residents are living with from the get-go, so they don't require health interventions, medical appointments, follow-up, and that type of thing. We do work strongly with the medical provider community, and what they're looking at doing is reducing either the impact of certain things such as diabetes, heart disease, obesity, and then also they don't want a recurrence of an event. So if an individual has had a heart attack, they want to prevent a second one from occurring. And so I think it's really about prevention, but as I said, we really look at the primary prevention. And I think that's one of the key things, though, as we looked at last night, were the partnerships, the work we do in and about the community. Public health, we look at the 103,000 Woodbury County residents and we say, what is it we can put in place that we can ensure they have what I call access to health? Those opportunities to develop healthy lifestyles and to live healthy lifestyles.
And that's great too, because even like what the vision of the Siouxland District Health Department is healthy community for all too, and I think that's really relates back to what you said too, is just creating that access for everyone, just to have that opportunity to make those healthy choices then too, making it the easiest choice then too. Could you share some examples of some of the work that Siouxland District Health Department has done for communities with public health then?
Well, I think one of the things that first off to get it, you are thinking of the right place when you're thinking of immunizations and the WIC program, or Women, Infant, and Children. But we do so much more than that. I think it's important for the public to understand. One of the things, as I mentioned, is the access to health. When we look at that and setting up reducing the barriers, many times we used to focus on the aspect of how do we get them in for medical or other intervention appointments. When we take a step back further and say access to health, I'm looking at what's within our community as far as sidewalks, the ability to go biking, non-motorized transportation. What's their access to healthy foods and basically fruits and vegetables and other items? We've actually looked across the city and looking at the food deserts that exist, and these are areas that there is a distinct barrier to individuals getting to those healthier foods, because in many times they may have limited access by local convenience stores and that, which are getting better, but it's not the variety you'll find in a full-fledged grocery store. In addition to that, with some of the work that we've done, we look a lot with the community partners in the access to health with our disabled community. We spend a lot of time in working to help other systems or organizations understand what are some adaptations they can make in the service of the work or the recreation that they provide that allows anyone the ability to participate. Then we've also reached out into some of our rural communities. We think it's important out there that they have walkable communities. Those young children, looking at some going to school, walking to the swimming pool, the library, we want to make sure that the communities understand, and they're looking at supporting, which has been great, like the installation and maintenance of a strong sidewalk system. that is a pedestrian mode of traffic, and those children then are able to transport themselves on that without a motor vehicle. And so I think those are things, and the reason that's important to us is that is a health activity or a physical activity type of thing that they're doing. And we see those individuals that incorporate that into their daily lives have less issues as they age. Obesity is less prevalent. They turn around, there's probably less incidence of disease such as diabetes. The heart disease may be better. So we really look at, we can get those behaviors established when they're children. We hope it continues into their adulthood.
And really, like what you said too, is just it's creating that healthy environment too. Either it's easier access to be walking somewhere, somewhere where it's safer for them to be walking, maybe to and from school or in evenings, things like that too. Really, it's just like you said, just working and creating that environment where it's safe to make those choices, and it's easier to make those healthy choices then too. So.
And also related within the environment that's a part of the public health is really looking at some of what our practices, and that is, we do extensive work out there in maintaining and protecting the groundwater. We have a private well water testing. We also test the water within most of our municipalities. There's a private septic permitting process. We want to make sure that whatever's handled for that human waste and that is not get into a water source. And so there are guidelines that we followed within the Iowa Code. In addition to that, we take a look, we do the food establishment inspections. We want to make sure they're complying with food code, and the goal for food code is to assure that when you go out to dine at a local establishment, you can have assuredness that their practices support that and prevent prevalence of any sort of disease, and basically what it amounts to is you getting sick.
Yeah, and that's just even the one edition of the program of many different things that are done at the health department here too then. So, and they do a lot of great work throughout even just Northwest Iowa in that area then too. So what are like the different programs that are offered through a Siouxland District Health Department, and how do they benefit the health of the community then too?
As I looked at with the prevention, I said with the environmental health, with the inspections, the outwork, the education, healthy homes. They want to make sure that they're out there, that is in looking at lead, radon, and also just the cleanliness that exists within the homes, and then some safety factors when you're dealing with very young children. We have education and resources that we provide within that. We do have a clinic services side that we end up doing. That's where our immunization program comes from, our WIC. We also look at services for every pregnant female in the county. We want to get them into early preventative program to have a better prenatal experience, and more importantly, we want to make sure they get the appropriate medical prenatal care prior to delivery, because we're really interested in having healthy moms and healthy babies upon birth. And we say that as long-term, we take a look at some of the things that we do. In the area, we have health promotions also. The work done in that area, they address needs and things within tobacco. That's part of what we do, the community outreach with some of the accessibility and access to health that's going on. And then really it's about promoting that public health or that prevention message. How do we get that word out there? How do we educate more partners on how we can work together to be able to do that?
Yeah, and I really like what you said too, of just like it's helping to get that easier, healthy access for people then too. Like you said, healthier moms so that they have some of this access to resources, access to information then too. It's really just, helping people have that easier access to the health then too. So before you mentioned community partners and that they play a significant role on the work that is being done in public health and with Siouxland District Health Department. Who do we kind of work with usually for some of our programs, and what kind of work have we've done together to help improve the health of our community then?
Partners are all over the board for us is what it would be. We're very rich in partnerships and collaboration. We have partnered with all of the hospitals in the area, and that includes Dune Surgical Hospital in our community health needs assessment, health improvement planning with prioritized needs. With some of the other areas, the transportation planning councils that exist out there, we are members of that, and we have staff that sit and actively participate, and then also provide some of the resource and guidance. Sioux City Parks and Rec, Woodbury County Conservation, we look at working within those. And then in our outreach into the county, as we worked actually with our basic municipal areas, so the smaller towns that exist, and kind of gone some consultation guidance, and in some cases we've had grant funding to offer them to support their work and the efforts that they're doing at improving their communities. And so we can't, every time we look around, there's new partners that seem to appear, and we're just thrilled about that.
Yeah, and they just are, so great to be able to get their expertise on too, because these ones who know the community so well, and they, know some of the maybe needs and some of the resources with it then too, and it's really great to just see the partnerships form and the great work that can be done together, and just being able to do that work in public health then too. So.
Yep.
Can you really, sometimes it gets a little difficult for some people to know the difference between what healthcare is and what public health is. Can you explain a little bit about what the difference between those two are?
What I look at public health is the population. We see those 103,000 residents of Woodbury County as our potential for service. When we're looking at healthcare, what we're doing is they do preventative follow-ups. They actually have, and I think the biggest difference we say is that we really term the individuals we work with as our clients, as opposed to when you go into the medical facility, you become a patient. And what we want as a client is we want a relationship. We want to make sure that we're working with them to make good decisions to move forward. And if that means that we are referring them into the medical community and the providers, that's what it is, if that's what's best for the client that we work with. We are not ones that dispense medications. We are not ones that do what I would say diagnosis. We are really looking at identifying, and so our information would come to us in public health if we have a report of a disease. We do the follow-up or the research behind it. Where were they at? Where do they feel they received it? What's the specific source? I mean, those are all things that we focus on the disease prevention in, and then it's really they enter the medical community when they have some issue. And what we're thrilled about in the last few years is really the wellness screening that's beginning to go on. Kids that are not going in for medical issues, but they're having an assessment to determine how healthy are they and are there any needs that need to be met.
So for me, this question kind of came up when I was, just getting back into going back to school for grad school then too. And it always thought to me is what makes somebody healthy is just the healthcare that they're receiving and going to, getting to the doctor and getting your checks. But for me, when I was going back to public health for my master's, realized that really wasn't true actually, and that there's other determinants that really play a role on people's health, other things like that too. So what are some of those health determinants that actually, make people impact at their health then too? And what are some of the areas that have been improved through public health then?
Health is linked to many aspects within a human's life. One, the house where you live, the residence, the area where it's at. It may be the home itself and the condition of the home. More importantly, there may be things within that neighborhood or area over which you live that have an impact. Your zip code does make a difference in your health. There's research across the U.S. that validates that. In addition to that, the attainment of education. They look at the demographics and going across that is those that are probably on the higher end of the education level. And as soon as you say this, somebody brings up a specific case that counters it. But overall, when we look at the total population, education can be a marker towards your long-term health. Some of the things we look at, the years of lost life that occur because of people dying prematurely from certain diseases. I mean, those are a piece of it, and we can link that back to certain things within their background. So there can be the education, their economic status, there's things related to what they have for access to health care. If they don't have any sort of payment source, they may delay getting treatment, which then can exacerbate other problems or be worse when they finally move into that intervention stage. And so I think those are all things we have to look at around the world and around our community and say, how is this impacting, and how do we identify, and then what do we do with it?
Yeah, and that's one of the things that really stood out to me is when I started getting more involved with it too, is just public health is such great leaders and knowing some of this information, and that's why it's so important to help improve and help promote positive, healthy measures in all of those environments. Whether that's sidewalks, access to healthy food, different things like that then too. Just because really it does make a difference of where you live and the access to the health needs in there. So, which is really neat to see how public health looks at that as a whole and saying how can we improve our community for everyone, not just necessarily this one or that one. It's really looking at how we can improve that to all. And that's one of the things that really kind of is so exciting about public health is just the work that is being done is improving it for everyone then. So.
Yep.
Is there any additional information you'd like to share about Siouxland District Health or just public health at all then too?
I just think what it is that we look as a public health institution. Our goal is to work with and for people to be able to improve their access to health. And no matter who or what it is, as far as organizations, there may be an opportunity for us to partner.
Yeah. Well, thank you so much for your time today, Kevin, and thank you so much for sharing this information on public health then too.
All right. Thank you, Steve. Have a good day.